My name is Dr. Alfama. I'm the president of the Korean Foundation for International Health, Global Alumni Ghana chapter. As part of our KG activities this year, we're embarking on a Clubfoot sensitization program to bring Clubfoot to the awareness of mothers, parents, and healthcare staff.
Around 174,000 children, 1 in every 800, are born with Clubfoot globally every year.
Clubfoot is actually the deformity of the foot that normally occurs from birth, and it is characterized by severe twisting of the foot.
Mostly when a baby is born, you might see the foot has turned inward down, and then there's also stiffness in the foot.
The top of the foot is usually twisted downward and inward, increasing the arc and turning the heel inward. The foot may be turned so severely that it looks as if it's upside down, causing a child to walk on his ankles.
Me call me banu MND hospital. Me weak no, and I mean say there is a problem with the left foot. Na me tete nsem bebre say ma wo yare for a ontumi nante. Nti na me yem hyehye me. Na me ni arehemu bia say bia me ba ne be nante.
For children born with clubfoot in lower and middle income countries, less than 15% will access treatment. The rest will face a lifetime severely affected by their clubfoot.
If the child is left unattended to, the child becomes a permanent disability in our society, and it becomes a burden on the family, it becomes a burden on the country as large. That's why we find street children who cannot walk, crawling in traffic, begging for alms.
Most children born with clubfoot in lower and middle income countries experience ongoing pain, limited mobility, and reduced opportunities in education, employment, and relationships.
Because of when I
Parents with clubfoot babies are often shy from disclosing the deformity of their children. This is a result of stigma associated with clubfoot.
My parents, now almost kasa, there was this stigmatization. Almost family, other siblings now almost so. Never nine back where you real room. May I have me pa? Because way our clinic be. Way into the ukwa, ye baby akola ni ho ansa ya way in public. Into your way no. Na nkrofoti ho na omo kan say, "Eh, mo sha akola ni nan. Akola ni ye yarefo. Me ye."
The unfortunate aspect of this deformity is that, especially for most mothers and parents out there, they tend to always have this superstitious spin on it. So there's a delay in the health-seeking behavior.
Some mothers think that it is the case. It is not true. The cause of clubfoot is unknown, and treatment is available here in Ghana in our health facilities.
We do not know how to prevent clubfoot, but we do know how to treat it, and it costs less than $400 a child.
The Ghana Clubfoot Initiative started in 2008 as a partnership with Focus, Cure International, and with local health facilities, and in partnership with the Ghana Health Service. The partnership was to train health professionals on the management of clubfoot using the Ponsete method. That is the gold standard approved by the WHO.
Here what we do is that we use the post-senti method of treatment Clubfoot. We do our first assessment plus the scoring, which is using the Pirani score to determine the severity of the foot. And then we start with the casting. We do weekly casting. After every week, we reassess, and then we do a POP, a maximum of 6, sometimes 4, and then the foot is ready. Then we start with our bracing, and this is the brace that we use, which is called the foot abduction brace. Mostly we admit our patients here for the weekly casting, then when we are done, we discharge you with the brace.
The success rate for treating Clubfoot is very high when identified early. You are looking at about 90 to 95%, and this is based on studies that has been conducted over 50 years.
Omohwe me bayina ya omahye no baako mienu de tosom yenseni atene awie ti yeyiwe pa yebeku fie nyame ayado me baaye 2 weeks mani so me baaye no me hu improvement say abem ya she first one, second one, third one and ya san she ti me de menya ni je bi wo me mu say nyame aye ma me ba no me ba ma hu kwala bibra omo na ya tene me kura me hu ye ehye me nkwa ma manije esi me ba na hu be den ebeto no
me ba otisi ha no many ade pass within 2 weeks per omotumi treat Clubfoot no ama ni nyina ekọ me ba nsi se otumi gina ho
ọma ya amasisi ane nan no ayeye isi otumi gina first aka otumi gina ba sisi ade ni nan natin otumi gina ni na so
first no not because of Clubfoot nit na me dem pobo ahye na who say empobo no atene akọ the other leg no ho but for now you treating any there what the shena is straight.
The evidence is quite overwhelming. What KG is doing now is that we are trying to encourage all of you out there, the mothers, everyone, the frontline health workers. Once you identify any child or any baby with this deformity, refer the baby to the appropriate center so at least treatment can be initiated.
Clubfoot is something that is preventable. This is the reason why Coffee is partnering with the KGA to sensitize parents and other stakeholders on this abnormality. Any mother out there whose child is suffering from this kind of abnormality should go to the hospital for treatment.
Menya kamena no ko beya mso akechi. Martin there say abofrabo mo a eko hospital obotum wa hwe no waye wona na wadamo. Awofo womba wana ti dem no fon yere no fon hospital no wa hwe mo hwan.
We entreat all parents with babies with Clubfoot to visit our facility to start the treatment of Clubfoot. It is not costly.
This year, as part of our activities in KGA, we're having the sensitization program, and we'll have eminent persons and specialists in that area educating us on the prevalence, the problems that are associated with it, the stigmatization, as well as ways of dealing with it. Encourage any Clubfoot within your facility or in your catchment area or society to seek medical attention because help is available.